Hello everyone, I am Dr. Sonali and today we will be talking about hypersensitivity. So I have divided this lecture into two parts. In this lecture we will be talking about hypersensitivity 1 and 2 and in the second lecture we will be talking about hypersensitivity 3 and 4. Let's start. Before we start, let's see this question. A 21-year-old female presents to the emergency department with sudden onset of difficulty in breathing, wheezing, generalized urticaria and hypotension shortly after eating peanut butter at a friend's house. Now on examination, she is in respiratory distress with a blood pressure of 80 by 50 mmHg and widespread skin rash. Now she is immediately treated with intramuscular epinephrine followed by antihistamines and corticosteroids. She improves rapidly. What type of immune reaction is this? This is the question. What type of immune reaction is this? Now, I won't tell you the answer, but as we move ahead in this lecture, you will be able to answer this. And I want you to comment the answer below. Okay. So, you can get from your hypersensitivity topic, you can get a question like this, like a case. And then you will be asked to describe what kind of immune reaction is this, define its pathogenesis and all. Or you can also get short notes. Okay. This short notes can be all type of hypersensitivity individually, like your hypersensitivity 1, your hypersensitivity 1 can be a short note, 2 can be a short note, 3 and 4, all of them are equally important. And even for your multiple choice questions, lots of the questions come from this hypersensitivity. Okay, so let's start. Now, before we start, let's see what is the normal function of your immune system. What is the purpose of immune response? Normally, what happens when your immune system spots a foreign invader? It eliminates it with minimal fuss, that is localized inflammation, and then it gets back to being in a chill mode. But in hypersensitivity, what happens in hypersensitivity? The immune system, it goes rogue. It overreacts to even the small threats like pollen or self-antigens, which are not even real threats. It damages your own tissue and sometimes very severely. Okay. So what is the definition of hypersensitivity? Hypersensitivity is damage to host tissue caused by an exaggerated immune response after exposure to a particular antigen in a previously sensitized individual. Always remember this term, exaggerated. This is an exaggerated immune response. So, because after exposure to an antigen in a previously sensitized individual, anything happening in exaggeration is not good. It's harmful. Now, let's see the classification. This is the Gell and Coombs classification of hypersensitivity. So, we'll see each type individually also, but this is just to make you familiar with the classification. Type 1 is your anaphylaxis, which is IgE mediated. Okay, you have to remember which antibody is involved in which type of hypersensitivity reaction is very important. So for anaphylaxis, it's IgE mediated. Key mechanism is mast cell degranulation. Time, it occurs very immediately within minutes. Example is asthma, peanut allergy and urticaria. Then we have type 2. Type 2 is cytotoxic. That is IgG and IgM. Type 1 was IgE mediated. Type 2 is IgG and IgM. IgG or IgM. Your antibody binds to the host cell and then there is cell lysis. This is the key mechanism. Time, it takes hours. Example, autoimmune hemolytic anemia. Type 3, now it is due to an antigen-antibody complex, that is your immune complex deposition in the tissue which causes inflammation. Time, it takes hours to days. Example, SLE and serum sickness. Okay. Now you see your type 1, 2 and 3, they have some things in common. That is, their action is immediate. Okay. And another thing which is common in all three is they are all antibody mediated. And which type of immunity is antibody mediated? Humoral immunity, right? B cell. Now coming to type 4. Now type 4 is quite different from all the first three types. Type 4 is a delayed T cell mediated hypersensitivity. Here no antibodies are involved, it's only T cells. It takes days to occur, and examples are TB test and contact dermatitis. Okay, so your type 4, the hypersensitivity, this is a delayed type, and this is cell mediated. Okay, cell mediated immunity type. So now let's have a quick revision of all four again. So imagine your immune system is like an army which is quietly protecting your body. It is at the border, it's doing its job, it's protecting your body. But what happens in type 2, in type 1, sorry, what happens in hypersensitivity? In your type 1 hypersensitivity, your army sees smoke and thinks it's an actual threat and starts firing. The smoke means allergen. Okay. What happens in type 2? Your army starts firing on own cell. Okay, so this is type 2 hypersensitivity. In type 3, your army starts wildly firing. Why? Because there is foggy vision. What is this foggy vision? That is the immune complex. Okay. Sorry. That is the immune complex. And type 4 is like a special team which arrives late but still causes damage. Okay. That was your Gell and Coombs classification. Now let's start with seeing type 1 hypersensitivity. Now let's see the definition first. Type 1 hypersensitivity is an exaggerated immune response to harmless antigens, that is allergens, mediated by IgE antibodies and mast cell. You know, your type 1 hypersensitivity is like your typical Bollywood revenge drama. Okay, it's like a Bollywood movie. What happens here in first act? First act, what happens? There is first exposure of antigen or allergen here. First exposure of allergen to your immune cells, and your immune cells get offended and they hold a grudge. Why? Because they are very sensitive. So this is known as sensitization. This phase is known as sensitization phase. Okay. Now, second act is after the first exposure, when they are exposed again, that is the second exposure of this allergen, the same allergen. What will happen here? Your immune system will overreact. You overreact to this allergen. This is known as effector phase because some effect is happening. Okay. Now, let's see it. What is exactly happening inside your body? So, this is your allergen. This is your allergen. It's coming inside your body, and your antigen processing cell, your antigen presenting cell processes it. Okay, your antigen presenting cell processes it and presents it to your CD4 T helper cell. Now, your CD4 T helper cells gets converted into type 2 helper cells. Okay. Now these type 2 helper cells releases interleukin 4. Okay. This type 2 helper cells releases interleukin 4, which stimulates what? It stimulates B cell. And we all know what does your B cell do? It will make antibodies. And since it's type 1 hypersensitivity and we are dealing with allergen, what kind of antibody will be produced here? IgE. Now this IgE will go and bind to the surface of mast cell or basophil. Okay. Now you see this IgE will go and bind to the surface of this mast cell and base or basophil. Okay. By this F constant part of this IgE, that is the antibody, it binds. Now this was sensitization. Your very sensitive immune system has done what? It has gotten offended by this allergen and it has held a grudge. It has like, had a revenge plan. It has been plotting a revenge plan. Now, second time when the same allergen comes again here and it directly binds to your IgE. So this time what happens? Your mast cell will degranulate. It will explode like a bomb. Okay. It will do what? Degenerate. So this is overreaction. Okay. It's just an allergen. So it's overreacting. It's degranulating and releasing lots of mediators, which causes some form of changes in your body, like your vasodilation, your bronchoconstriction, which are harmful for us. Okay. This phase is known as second phase, effector. Clear? So this was your mechanism of type 1 hypersensitivity. So see here. This allergen enters via air, food, skin injection. Okay. The sensitization phase after first exposure. Your antigen presenting cell processes it and shows it to your CD4 T helper cell. Your T cells become T helper cells 2 and release interleukin 4. Interleukin 4 activates B cell and they become plasma cell producing IgE. Now IgE antibodies, they attach to mast cells and basophil by F constant receptor. Now these cells are sensitized, lying in wait. Now your effector phase. Allergen binds to the IgE on mast cell and trigger the mast cell degranulation, that is exploding it like a bomb. Now the granule releases pharmacologically active chemical mediators. And what do these mediators perform? Pharmacological actions like bronchial and other smooth muscle contraction, increased vascular permeability and vasodilatation. Okay. Now let's see what are these mediators. How many types of mediators are there? It is two types. One is primary, ready-made mediators which act within seconds. Second is your secondary or newly made, which acts after a few minutes. You see, your primary mediators are preformed. It's preformed mediators in your mast cells. Okay? In your mast cell. Example are histamine, your serotonin. Okay? Now comes to your secondary or newly made. They are made after exposure to or triggering by, or it's when it gets triggered by your antigen. Example, prostaglandin. It can be your prostaglandin or leukotrienes. Okay. Now, this is a diagrammatic representation to make you understand everything. Okay. See, these all mechanisms are extremely important for your exam. So the more you see, the more you listen, the more you will remember. Okay. Let's have one more revision for this. Your allergen. Okay. So what happens with your antigen presenting cells? It has come from the T helper cells to T helper 2 cells. Now this T helper 2 cells releases interleukin 4. This interleukin 4 will do what? Stimulate B cell. Okay. This whole thing has started from this part. Before that, this is not given in the diagram. That has already happened. Okay. What had happened? Your allergen has come in contact with your antigen presenting cell. Your antigen presenting cell has given this antigen to your T helper cell. Your T helper cell has converted into your T helper 2 cells. It has released interleukin 4, which has stimulated your B cell to release from plasma cells what? IgE. Now this IgE has come and bind to your mast cells. It has become sensitized. So now your allergen comes and there is degranulation releasing vasoactive amines. And then there is smooth muscles, cell contraction, small blood vessels. They'll act on that. They'll act on mucus gland, blood platelets, sensory nerve ending and eosinophil. Okay. Now let's move ahead. Let's see some example of a type 1 hypersensitivity. First is the systemic example, that is systemic anaphylaxis. What is systemic anaphylaxis? First, let's see the definition. Your systemic anaphylaxis is the severe, life-threatening emergency where the body overreacts violently to an allergen, causing severe BP, severe breathing difficulty, that is dyspnea, low BP, hypertension, vascular collapse, shock, which can lead to death if not treated quickly. Now, when does it happen? It happens within minutes of exposure in sensitized individual and requires immediate treatment. Okay. Now, let's see the type 1 hypersensitivity is triggered by what all. These are the allergen and these are the example. Stings of bee, wasp and ant venom. Antibiotics like your penicillin sulfa drugs. Nuts and seafoods like your peanuts and shellfish. Then drugs and antitoxins like your insulin, vaccines and contrast media. Now, there's a mnemonic for this also like SAND, SAND. This SAND is all the list of the allergen which can trigger your anaphylaxis. Okay. Now, let's see the treatment. Treatment is epinephrine, drug of choice, given IM immediately. Reverse bronchospasm, raises BP and reduces edema. Now, antihistamine, steroids and fluid and oxygen can also be given. Now, that was the systemic part. Let's see the localized example. Localized anaphylaxis, also known as atopy, that is allergy at entry points. So, instead of affecting the whole body, the reaction is localized to organs like your nose, lungs, skin or gut. It affects more than 20% of Indian population and it runs in families. There is a genetic predisposition for it. Okay, let's see the examples. First is allergic rhinitis. This is the first and this is the most common kind of atopy. Okay, what happens? Your airborne allergens come in contact with the conjunctiva and your nasal mucosa and causes what? Inflammation of nose, eyes, leading to sneezing, nasal discharge, watery eyes. Second is asthma. This is the second most common atopic condition. What happens here? Here your lower respiratory tract is affected. Okay. So what happens here is bronchoconstriction, wheezing, coughing and dyspnea. Then food allergies, allergen from gut can cause GI symptoms, vomiting and diarrhea. And sometimes these allergen from gut gets into our bloodstream and travel to your skin causing urticaria. Okay. Next is atopic dermatitis, that is eczema. Skin inflammation in children, that is itchy, pus-filled red rashes. Now there is drug allergy common with penicillin and sulfa drugs. Can cause local or systemic IgE reactions. Okay. Now these are the examples which you can remember. But there's more examples for your type 1 hypersensitivity. So I've come up with a mnemonic for it. Okay. The mnemonic is please come to see lovely garden. We'll see it one by one. So this P of please is for your PK reaction. Okay. The C is for Cassoni test for hydrated. This T stands for Theobald Smith phenomena. Okay. This S stands for Schutz Gell phenomena. This L stands for Loeffler's pneumonia. You can see this in ascaris with this form ascaris. Sorry. This G stands for ground itch. Seen with which organism? Hookworm. Okay. So whenever you have to write the example of type 1, this is the list. Apart from the one I have already told you, that is please come to see lovely garden. See, although systemic anaphylaxis and atopy you can still remember, but this is the tricky part. Okay. So we'll go ahead. How do you detect your type 1 hypersensitivity? We can detect it by your skin prick test. Like this. What you can do here is you can just prick all these antigens intradermally in your skin, and then you will wait to see the wheel and flare reaction. Okay, this is one way to detect. Second is you can do a total serum IgE antibody detection. Okay, you can do it by this radio immunosorbent test. Now this is obsolete now, we don't do it. Or so is it better to do a total serum immunoglobulin test, or you can do a allergen specific immunoglobulin test? Okay, it's better, right? So we can do an allergen specific IgE test. Okay, so how do you do this? You can do is by MIA, multiplex immunoblot assay. MIA is just a mnemonic, okay? Don't say it in your viva. It's for you to remember it, okay? Next is fluoro enzyme immunoassay. So you all know FIFA. This is PIA. Okay, that was your detection. Now let's see the treatment part. How to treat type 1 hypersensitivity? You can have this avoidance of contact with known allergen. This is the most common form of treatment, but also practically not possible. Okay, so next what we can do? Hyposensitization. You can give increased dose of your allergen subcutaneously, which will further, a repeated dose of these allergens subcutaneously. What will happen? It will desensitize the patients from this allergen. Third, you can introduce monoclonal anti-IgE to bind to the IgE antibody. Fourth, you can give some drugs. Drugs like antihistamines. Okay. So this was your type 1 hypersensitivity. Now let's go to type 2 hypersensitivity. Okay. What is the definition of type 2 hypersensitivity? It is antibody mediated tissue injury. Here your own IgG or sometimes IgM, but mainly IgG, antibodies attack cells by binding to antigens on the cell surface or extracellular matrix. Okay. Now what are these antigens? What kind of antigens are these IgG binding to on the cell surface or your extracellular matrix? Let's see. Where do these antigens come from? They can be self-antigen. So your own cell expresses various proteins. Okay, it expresses proteins like your RBC. This RBC membrane protein is there. Your own cell also have many receptors. Okay, like for your thyroid, it has acetylcholine receptor at your neuromuscular junction. Normally what happens, your body is tolerating all these receptors. Okay, it's very chill normally, but now we are talking about hypersensitivity. What happens in hypersensitivity? It has lost its self-tolerance and now it is attacking its own antigens, that is self-antigens. Okay, for example, like myasthenia gravis. What happens in myasthenia gravis? Your auto antibody, they block acetylcholine receptor where at neuromuscular junction. Okay. Second example of this is your Graves' disease. Okay. Graves' disease. What happens in Graves' disease is your autoantibody attacks your thyroid receptor, but they don't block it here. They will overstimulate it. Okay. Overstimulate or activate it. Okay. Now, third example is autoimmune hemolytic anemia. What happens in this? In your autoimmune hemolytic anemia, your autoantibodies are targeting this RBC membrane protein. Okay, this RBC proteins and causing lysis of your cell. Okay, now this was self antigen. Another can be your foreign antigen stuck to host cell. Example, in your drug induced hemolytic anemia. Okay, what happens in your drug induced hemolytic anemia, and which all drugs induce this anemia? It can be via quinine therapy, okay, or penicillin. What happens in them is, in these two, this is your RBC. Now your drug and their metabolic byproducts will come and get absorbed on the surface of RBC. Now this combo of RBC and drug is foreign to our body. So your antibody attacks and causes cell lysis. Okay. Next is your matrix or basement membrane antigen. See, your matrix or basement membrane, it's like a cement. Okay, it's like a cement which binds cells together. It binds cells together. Now, what is this cement made of? It is made of protein. This protein is known as collagen. Okay, so example of this is your Goodpasture syndrome. Your Goodpasture syndrome, your collagen is affected, type 4 collagen is affected of what all your lungs and kidney. The type 4 collagen which is present in lungs and kidney is affected. So that causes type 2 hypersensitivity. Okay, I hope with these examples you understood the basis of type 2 hypersensitivity. Let's move ahead. Now, what is the mechanism of it? Okay, what happens? How the damage happens? See, when the antigen, you know where all the antigens are coming from now, when this antigen and antibody combines, what happens? See, this is your antigen and this is your antibody which is combining. Okay. Okay. Now this is the F constant receptor of the antibody. Now this F constant receptor of the antibody, it initiates, what it does is binds with some proteins in the serum known as complement. And it will do what? It will activate your classical complement pathway. So complement mediated destruction is the first mechanism. Once the antibody binds to the antigen, this binding happens and it triggers the classical complement pathway by this FC receptor, FC part of the receptor. So there is lysis. There is lysis of this target cell by formation of membrane attack complex. That is your C5 to C9 complement. Forms your membrane attack complex. They make holes. They make these tubular holes and the cell dies. Second, by inflammation, your certain complements like your C3A and C5A, they attract neutrophil and they cause local tissue damage. Then is your opsonization. Certain complements like your C3B and C4B access opsonin. What are opsonin? See, you know, whenever you want to make a dish tastier, what do? You sprinkle something on it. Like your pizza, many people like to eat it with chili flakes and oregano. Your opsonins are your chili flakes and oregano. It makes that antigen and this antigen combination of antibody very delicious. So the macrophages come and eat the cell, okay, making it yummy. Example, mismatched blood transfusion, hemolytic disease of the newborn, autoimmune hemolytic anemia, drug-induced hemolytic anemia, and pemphigus vulgaris. Now, these examples are for your complement-mediated destruction. Now, Let's see how is it happening. This is your target cell, okay, your antigen. Now these are your antibody. This is the F constant part of your antibody. Always remember this. Now this F constant part of your antibody, it comes and attached with the complement, and through the classical complement pathway, they form this membrane attack complex, that is C5 to C9 complements. This is the membrane attack complex. You see, this is like forming a hole through which lysis occur. Now your opsonization. See, this is this antigen antibody complex, and these are your chili flakes, your C3b. Okay, they are making it what? They are making it yummy. So phagocytosis by macrophages happening. Clear? Now let's see your antibody dependent cellular cytotoxicity. If the target is too big to eat, like your tumor cells mostly, then what happens? Normally, if something is too big to eat, we cut it into pieces. So antibodies, what they do, they coat the target, and the FC region of antibody bind to this NK cells, eosinophil and macrophages, and release toxic stuff to destroy the target, like your tumor destruction by your natural killer cells. If this is a very big target, like a tumor cell, okay? So your antibody will come and bind to it, and with the FC receptor part, like your natural killer cells or macrophages will come and bind here and will release the toxic stuff and do what? Kill this target. This is a diagrammatic representation of the same thing which I have explained. Target cell, your antibody comes and this FC portion binds to your natural killer cell, and then there is apoptosis. Clear? Now, the autoantibody mediated dysfunction, ADCD. You see, normally you get questions with this name only, but very few places, not many, very few places, you can come across this type 5 hypersensitivity. Few places I have seen that if sometimes a question comes and they mention type 5 hypersensitivity. So this is the example of, this is not an official classification, but some textbooks have referred it like that. So don't get confused at that time. Your type 5 hypersensitivity is nothing but this autoantibody mediated dysfunction in type 2 hypersensitivity. Clear? So what happens here? Autoantibodies are produced against the receptor, causing either overactivation or inhibition of the receptor. Like your Graves' disease, it activates the TSH receptor, increases thyroid hormone, causes hypothyroidism. Myasthenia gravis blocks your acetylcholine receptor at the neuromuscular junction, causes muscle contraction and weakness. Pernicious anemia blocks intrinsic factor and causes a decrease in your B12 absorption. Okay. This was all for your type 2 hypersensitivity. Before we end this lecture, I want you to remember the examples of type 2 hypersensitivity. Okay. For that, I have a mnemonic to make it easy for you. Now, so you see, when you are doing your PG, you like tea. But when you do your DM, it's a bit difficult than your PG. Then what do? You start liking coffee because you need something to be more active. Okay. So this is the PG, tea, DM, coffee. Now let's see. P stands for pernicious anemia. Or pemphigus vulgaris. Okay. G stands for your good pasture syndrome. T stands for your transfusion reaction. Okay. E stands for erythroblastosis fetalis. Your A stands for autoimmune hemolytic anemia. D stands for drug-induced hemolytic anemia. M stands for myasthenia gravis. And C stands for Chagas disease. Not your whole disease, but the myocarditis part is type 2 hypersensitivity. I hope this lecture helped you to understand both type of hypersensitivity. Now, before I end, let's see the answer of this quiz. What type of immune reaction is this? It's type 1. I hope you were able to guess it correctly. Thank you.